I received an exhibit list. I appreciate that very much. The clerk has it too. And so my understanding is I can now move in a lot of these joint exhibits at this time. Is that correct?
That's correct, Your Honor.
Okay, the court's going to receive, without objection, the totality of exhibits 101, 102, sorry, 1001, 1002, 1003, 1004, 1005, 1006, 1007, 1008, 1009, 1010, 1011. Actually, it goes all the way through all the way through 1083. So the court will receive 1001 through 1083 in their totality. Okay, so what's next that you all would like to discuss?
We have some additional exhibits the court will be pleased to know we've managed to stipulate two. One is 2004-6 through 6-3. We removed pages 1 through 4 at the defendant's request.
How about page 5?
That's a good question. Is page 5? It was removed, sorry. Mine just said 4.
So at this point in time, 2004-6 through 63 may come in, is that correct?
Yes, sir.
Okay, so the court receives 2004, pages 6 through 63, and I'm assuming I can also receive 2005, 2017, 2512 at this time, is that correct?
Yes, sir.
Okay, so I'll receive 2005, 2017, and 2512.
Additionally, Your Honor, this morning we were able to reach agreement on 2006 through 2009, which are the Tashana Duncan psychological records.
So are 2006 through 2009 in their totality coming in?
I believe so. That's my understanding from Mr. Shapiro.
The reports, not the attachments.
Whatever constituted 6, 7, 8, and 9. For the record, they are 2006 is psychological evaluation of Maya Kowalski, 2007 evaluation of Beata Kowalski, 2008 evaluation of Jack Kowalski, 2009 Kyle Kowalski. So just the evaluations.
Just the report, yes, sir.
Wait, since I don't have those documents in front of me, are there any exhibits attached to those? So, I don't want to make sure. Okay. So the court will receive 2006, 2007, 2008, and 2009 in their entirety.
We have a few additional exhibits which we can either take up now, constituting 2030 down there at the bottom, up and through 2792. Of these, the only ones that I think are pertinent to the first witness would be 2792, which are growth charts pertaining to Maya Kowalski provided by Dr. Wassenauer, and these were part of his file, although for some reason 2 items when we were going over his testimony we just had never seen before, or if we did, we didn't notice it. One is 2792, which is a growth chart pertaining to Maya Kowalski provided by Dr. Wassenauer. Can we pull that up for the court?
I'm gonna.
Your Honor,
Yeah, one second,
we're not going to be objecting to 2792. We just need a copy.
Can you hold on one second? I'm going to turn it off and turn it back on because for whatever reason, the public galleries are not coming on. So let me try this again. There we go. Okay, so Ms. Crowell, which one are you not not objecting to?
2792, we found 2792, the growth charts.
And that's only a one-page document?
No, there's multiple pages.
So am I receiving the totality of 2792?
Yes.
Yes, sir.
Okay, the court will receive the totality of 2,792.
Then, Your Honor, again, there was one other that was, if it was in there, we simply did not notice it. And I don't believe I've given the defense enough time to see if it was in their production from the doctor, but part of Dr. Wassenauer's file is Trial Exhibit 2375 for identification, obviously, right now. I have a copy of it for the court. We've got it up there for you. And the physical copy here, we provided to the court. The court will see that there's actually physical imprints of Maya's lips, a kiss to her parents. It is part of his medical records and was provided to him by the Kowalskis as to how Maya was doing through this.
So this one's not on the list for
Correct.
2375.
I don't think it's on the list. It was added this morning, Judge.
Does the clerk have a copy? Okay.
Your Honor, we object to this exhibit. It's hearsay. It's clearly not a medical record.
I'm sorry, Natalie.
We aren't choosing it as a physical exhibit unless it's in here. In the judge's decision.
Is 2375 the physical paper? Is it in the possession of the clerk?
This is it right here. So, answer to now, I can provide it to the clerk right now.
Is that two-sided?
Yes, if you flip it over, the court can see the actual imprints of the.
Because if you want the clerk to put this into at least being marked,
Yes, sir.
we need a physical copy, so we're taking
That's
this
it.
one? Okay.
That's the original.
And page 1 is where it says Dear Mommy and Daddy and Kyle. Page 2 is the balance, the other side. So this, well, let me hear the objection.
Hearsay. It's not a medical record.
Mr. Anderson?
Exception under 803. First, it's a medical record, Your Honor, and we've waived.
Is this being used for the purpose of diagnosis or treatment?
Yes, it's as to her Maya's state of mind and feelings at the time, and the inside of that obviously are also then existing mental, emotional, or physical conditions, which is 803.3, and then of course 803.4, and this was provided, I don't think by Beata, I think this was provided through Beata, or by Maya, but provided by Maya through Beata, and I believe there's an exception in hearsay for minors providing medical information.
Judge is not even, oh, sorry. May I speak?
Sure.
It's not written to the doctor, it's written to her family.
Here's my thought is, I think if you want this to be a medical record, you're going to have to lay a foundation through the doctor who relied on this document for purposes of medical care or treatment. Let me just... So ultimately, I have the ability to preclude the jury and then turning off the monitors in the gallery as well. So you can still publish it, or actually we have the physical paper. We can show it to the witness without the jury seeing it.
I have the doctor here. We could probably do it out of the province of the jury if you'd like to save that. It's up to you, Judge, however you want to do it.
It's your case. I'll defer to however you want to do it. But I mean, if to the extent it's something that Maya Kowalski state of mind or anything like that, I think you're going to need foundation from her to get it in. So, because right now it's hearsay
I
without
understand.
an exception.
All right. Probably what I'll do then is I can put Maya on the stand right now out of the province of the jury to identify this and her reasoning for forwarding it to her family, and then the family, obviously we don't have Beata, but I think that is the purpose of 804, paren, sorry, 804 2F, statement offered, declare unavailable. So I can put it in through Maya's foundation and then have the doctor come in and complete that.
Whatever you want to do, but I mean, this is a statement by Maya Kowalski, so I'm not sure why Beata Kowalski's unavailability has anything to do with it.
Well, she was, I believe at this time, in Johns Hopkins Hospital, and so was unable to be, obviously she couldn't get something directly to her doctor. She mailed it to her mother, who then provided it to the doctor, as I understand it.
Whatever you'd like to do.
Okay.
Are there other exhibits that are agreement or that we have to deal with before the jury comes in?
Not on behalf of the, well, let me see here.
I see a whole bunch about, I guess to Shauna Duncan, a lot of them were admitted, but there's still others. I'm assuming she's testifying today.
She is, after lunch.
Objecting to the, all of the documents filled out by other people, not her reports as we've indicated, but we're objecting to 2504, 2508, 2509.
And basis on those is,
Well, they're hearsay, it's improper character evidence if you look at the contents of them. Some improper opinions, but they're essentially hearsay, Judge.
We're not putting those in through this morning, through the witness. We'd like to do that maybe at lunch or just before this afternoon. The document we would like for our first witness also is 2002. It's third from the bottom on the court's list. It's a discharge document from Johns Hopkins All Children's Hospital. The
We
reason
don't have
it's,
any objection to that, I'm sorry.
Okay.
If I did indicate one way or the other, I apologize.
all right, no objection.
Okay, court receives the totality of exhibit 2002.
one moment, Your Honor. That's mine right here. And it's in evidence, physically.
You also want this?
Okay, yes, I've got that. And one other relatively minor point, but important to the Kowalski children, is we need to get some kind of note from the court so that we don't have truant officers interrupting the trial for school to say that they are participating in the trial as parties, if that's okay.
I'm sure I can do something like that, but my recollections, they're online or virtual learning. I don't know if you can time shift with that or not.
Do you need it? One moment, Your Honor, I'll ask. Apparently this has to do, the court is correct that they do remote. However, there are different projects and assignments that are due, that are lengthy, and the teachers have requested something to indicate for their filing why they can extend a number of these assignments that are important to their grades.
Any objection from the defense?
No.
I'll get something.
And I think that's it, Judge. I think we're ready.
Okay, so what are we doing about those exhibits that have not come in that you wanted to use this morning?
Well, I'd like to cover them, if the court is amenable, beginning at 2011.
No, he's asking.
What? We've got about 12 minutes before 9 o'clock, so whatever you want to do.
You know what, I'll do Maya now. Maya, can you take the stand? I'm just gonna ask about this.
Yes, she needs to be sworn.
If you can face the clerk, raise your right hand.
Do you solemnly swear or affirm the testimony you're about to give will be the truth, the whole truth, and nothing but the truth? Yes.
Go for it.
It's good practice. State your name for the record,
Maya Kowalski,
and where do you live?
Venice, Florida.
And are you one of the plaintiffs in this action?
Yes.
And was there a period of time between October 7th, 2016 and January 14th, 2017 when you were kept at Johns Hopkins All Children's Hospital?
Yes.
During the course of that, did you from time to time write letters to your mother, your father, or your brother?
Yes.
Let me show you, if I may approach, Your Honor. What's been marked for identification, Trial Exhibit 2375, and ask you to identify whether you are the author of that,
Yes, I wrote the note.
and that is your handwriting.
Yes.
And so, although I don't see that it's dated, is it in any place?
It's not.
But do you recall that whether this was written during the course of your stay at Johns Hopkins?
It was written when I
And
was
can you see
staying.
that from what is written there, the descriptions?
Yes.
And in writing this, were you expressing your existing at that time mental, emotional, and physical condition?
Your Honor, I just object to the leading.
It's a minor.
I'm gonna sustain the objection.
Okay. What was the purpose involving, what if any involvement does the document reflect as to your mental, emotional, or physical condition, if you can look through it there?
Well, at the time, I desperately missed my family. I wasn't allowed to really have any contact with them. So in this document, I'm expressing how much I miss them. I was extremely depressed. And in the little, as far as physical-wise, how I was doing, if you look, there's a heart, and in the heart is pictured my mom on the very far right, and my brother, me in the wheelchair, and then on the very far left would be my dad. So it's showing that I'm still sick.
Were you attempting at this point to address your health while in there?
Yes, but
And
I couldn't explicitly state it.
Because what?
I couldn't explicitly state it because they wouldn't have sent the document.
Was that your intent, however?
Yes.
And did you state in there the status of your pain? I think it's in the top. Is mine, can I see that up here? Or has the judge got that shut down? I gave away all my copies.
You can put it back on the screen.
When you say not doing the best, but I'm hanging in there, what were you addressing?
I was trying to express that physically I wasn't doing very well. I was in a lot of pain with my CRPS. On top of that, I wasn't doing well mentally because, I was a kid and I was taken away from my family, so you could only imagine.
During this period of time was Dr. John Wassenauer your pediatrician?
Yes.
And through the course of your stay there, did it come to your attention that your parents from time to time would keep him updated?
I figured, I didn't know that entirely, but I could assume.
And did you trust your parents at that time, your mother or your father, to provide information to your pediatrician about your status during the period of time when you could not directly communicate?
Yes.
Just a couple quick questions. Do you know the date that this was sent?
I do not, I'm sorry.
Okay. And if I understand what you were telling the court, the purpose of this letter was to communicate with your mom, dad, and your brother?
Correct.
Okay. Do you know if Dr. Wassner ever came to see you at All Children's?
Sorry, can you repeat the question?
Sure, yeah. Do you know if Dr. Wassenaar, your primary care pediatrician, ever came to see you at All Children's?
I believe he did not.
Thank you for your time.
Anything further?
Anything further from the court?
No, anything?
I do not.
Okay, Ms. Kowalski, if you could go ahead and seat.
Thank you.
Any further argument on this? I guess we'll start with the defense.
Respectfully, Your Honor, the letter is self-explanatory. It's from Maya while she had a period of no contact due to DCF orders. It's written to her parents. It's not written to the doctor. It's not for the purpose of medical evaluation. I think it's self-explanatory. She wrote it because DCF precluded contact between her and her parents. So there's not a medical exception to this, and it's otherwise hearsay.
What about the state of mind exception?
It wouldn't be relevant to Dr. Wassenaar, to his testimony. I mean, this might come up again as to Maya's, but I don't understand why this would be relevant to an inquiry to be included within Dr. Wassenaar's records.
Well, at this point, I agree that there hasn't been enough shown for 90.803 per 4 for purposes of medical diagnosis or treatment. It's quite possible that Dr. Wassenaar will say that he used it as such. But I do believe it would qualify and is the exception under 90.803 paren 3 than existing mental, emotional, or physical condition. So I don't have a basis to preclude its admission. So,
Move to admit.
you want to talk to Dr. Wassenaar to see if the other basis is there as well, or?
We covered during,
I'm so sorry.
we covered during cross, Your Honor. I mean,
Okay, then I'll receive Exhibit 2375 over the defense objection. What's next?
I believe that's it. Well, no, we have 4 minutes. So there's a comprehensive med psych evaluation by Dr. Henschke. She is the psychiatrist. This is at 2011 for the record. I do not anticipate her testifying this week. So you're aware
Judge,
of
I
it.
think the issue is, we objected to pages 8 through 13. We discussed this quite some time ago with counsel. 8 through 13 is a letter written for the court and an affidavit that she did for the court. It's not part of her medical record. So we're objecting to pages 8 through 13 of the record.
Can you put 813 up real quick?
Sure.
Okay, keep scrolling. Keep going, please. Next page. 12 and 13, please. At this time, the court agrees that pages 8 through 13 of Exhibit 2011 are not admissible. So are you agreeing that the balance of 2011, except for those pages, can come in?
Your Honor,
Subject to.
Mr. Anderson and I just had a brief discussion about this. There are certain portions of it that
Should we approve
I think
sidebar
he
for this?
wishes to redact. I won't say what they are, but I think it's something he and I need to talk about.
Okay, so I will not move it in. You all can figure out whatever needs to be redacted.
Right.
If we need to substitute out with the clerk.
You can mark it for identification at this point, Judge.
Well-
Before it goes in, there needs to be a substitution.
Once it gets marked for identification, then
It can't be
Can we just hold off on this? You
Well,
don't need it.
let's approach sidebar so I can explain to the court a little bit. Well,
is it something for today?
no.
Then let's not deal with it today. It sounds like the defense had a couple of issues they wanted to talk about before we brought in the jury.
Yes, Judge, we have advised counsel that we object to several of the witnesses that they have indicated they might call today, and I don't know if we want to address that now or
Which witnesses?
later. I don't know if they're calling them or not.
What was, what witnesses?
One is Meg Boland, and the other one is Alina Kirschner.
We're not calling either today. I don't think we're calling either this week. There's a possibility of Elena Kushner.
Today?
No.
Okay, well, they gave me them as witnesses for today. We also, they indicated they want to play the deposition of Dr. Napolitano. We object to that. We don't think he fits within the requirements of the expert exception. And also, they left in, I'm sure inadvertently, but they left in a section that was sustained. The objection was sustained.
Well, I mean, I've already ruled on the Politanos, so if I sustain the objection, it needs to be cut from the video.
We didn't notice it, we didn't review it till 7 o'clock this morning, Judge, because we didn't get
Was
into
there
it.
any indication in there?
We sent the video to them last night. We'll remove the part. We'll take another look and remove that. We're not playing that today
Oh, you're not? Okay.
unless we run short on time. So
So Judge, when we had asked who they're calling then today, because they've given us like, those three were told, and they're not calling any of them. So we would like to know who they're calling, please.
I told Mr. Shapiro and
Just tell me who you're calling.
all right, we've got Dr. Wassenauer this morning, and also Ms. Brown, who was a witness to Maya there in the hospital. This afternoon, then, we have Tishana Duncan and Father Jack Costello.
Were those names provided to you?
Yes, yes, sir.
Okay. Let me ask, and I don't know if this is a Mr. Altenburn and Mr. Elliott question. I don't see Mr. Elliott. Where are we on the instruction that we talked about on Friday?
I talked briefly to Mr. Elliott, and last night I gave you a shorter edited version of it as well. I would be happy to talk about it sometime later today. I don't think you want to do that right now, but if you're also having the hearing tomorrow morning, I'm not quite sure how long or how much you want to cover, but I was sort of anticipating that they would tell me they want Mr. Elliott to handle it. You'll be there tomorrow.
My understanding is I can give you the morning.
It's important to try to get the ruling so that so we can get an instruction to the jury that we're not the ones that took her away, if we hear more of that today. I'm not sure whether that will come up in the testimony of Ms. Duncan, for example. That's an emotional issue that is not legally correct.
Well, for Dr. Duncan's testimony, I guess we'll hear whatever it is. I can give you the morning tomorrow. My afternoon, I've already given it for another case, the Manatee case. So,
Your Honor, we filed a response to that special instruction last evening.
okay. Well, the clerk hasn't docketed it yet, so it sounds like that's something we can address tomorrow morning.
Unless it becomes a big issue today, I think tomorrow morning is adequate.
Anything else from the defense before we bring in the jury?
I don't believe so, Your Honor.
And anything else from the plaintiffs?
Not at this time, Your Honor.
And you saw that I ruled on the round 2 deposition designations, and so,
Well, when this comes up again, Judge, we can address that.
okay.
That particular objection was omitted in others. It should have been assumed.
It was.
I just was referring to, like, there was 10 depositions over the weekend I
Right.
ruled on.
Yeah, and I was making reference, Your Honor, to Napolitano was one of them.
I think that was the first batch. Wasn't Napolitano the
Could be,
first?
Judge,
Yeah.
as well.
They all kind of blend together, right? After a while, all these depositions.
But
Okay. We ready to bring in the jury?
I believe so, Your Honor.
Let's bring in the jury. welcome everybody. Please be seated. I want to confirm while you were away for this 3-day weekend, you did not discuss this case amongst yourselves, you did no investigation, and you received no information. Is that all correct? Yes. Okay, did you all have a good weekend? Yes. Okay. Mr. Anderson, call your next witness, please.
Dr. John Wassenauer.
Face the clerk and raise your right hand.
Do you solemnly swear or affirm the testimony you're about to give will be the truth, the whole truth, and nothing but the truth?
I do.
We're gonna go sit. May I please record?
You may inquire.
Thank you. Please state your name for the record.
John Wassner.
And have you been called here as the Kowalski's family doctor?
Yes, sir.
Essentially. And so have you treated then Maya Kowalski, Kyle Kowalski, and before her passing, Beata Kowalski?
I have.
Just curiously, have you ever treated Jack Kowalski?
Not to my knowledge.
So I'd like to get the jury to know a little bit about you. You grew up in St. Petersburg, is that correct?
Yes, sir.
And then attended St. Pete College and University of Florida?
Yes, sir.
And you did a mixed internship residency in pediatrics and internal medicine?
I did a dual combined residency in adult internal medicine and pediatrics.
And where
at
did you
Duke
do that?
University.
And where did you do that?
Duke University.
So these two specializations, can you tell the jury just a tiny bit about the two choices you made, pediatrics and internal medicine, what you wanted to do in your career?
Okay, so basically, the program is the same as a conventional pediatric program and an adult internal medicine program. It just combines the requirements of both programs into an accelerated training, if you will. We have to sit for the same boards as straight adult internal medicine physicians do, and the same boards as straight pediatric physicians do. My original intention when I was making my way through medical school was to do pediatrics, but after an experience on an externship in the islands, I came back and Duke happened to send me a flyer on their program for internal medicine and pediatrics, and that's what I decided was for me, because I enjoyed the spectrum of seeing babies up to the geriatrics. It really appealed to me.
It's gratifying to you. And what are the additional or different attributes, qualifications in dealing with children over adults that you have noticed? And I'm speaking of this in terms of why you chose pediatrics.
Well,
that's
I was
a bad question, let me know. I'm known to ask
a
some
little
of those.
confused. I always tell my patients and people who ask, why do you do that? I say it's the two ends, the young and the very old, that are similar. It's the people in between that are different, and so it's really not that much of a stretch. You just have to keep in mind where people are at this point in time in their growth and development.
And are you board certified in both?
Yes, sir.
And how long have you been board certified?
33 years.
And how long have you been in practice?
33 years.
So, so the jury knows your group is called First Physicians of Sarasota? Is that
Yes,
right?
sir.
And is that part of Sarasota Memorial Hospital?
Yes, sir.
And through that, do you, and do you still do your own pediatric hospital work?
Up until 2018, we admitted to both hospitals, everything from pediatrics to adult internal medicine. Now the group, our inpatient work is limited to newborns.
How many years did you spend practicing in hospitals in the sense of admissions following patients there?
So that would be probably 28.
And over the course of your career, have you had the opportunity to treat patients with CRPS?
I've had a couple of adult patients. Maya was my first pediatric patient.
Outside of CRPS, have you treated other chronic pain patients?
Absolutely, it's a big part of the practice.
And so, did there come a time that Maya Kowalski and the Kowalskis, Kyle, Maya, Beata, became patients of yours?
They in 2014, 2015. Yeah.
Yes. All right. And so, through the course, and do you continue to treat them to this day?
I do.
Approximately how often do you see them?
Depends on what's going on. Recently, maybe once or twice a year.
Okay. And then up until, let's say, the summer of 2015, how would you describe Maya's health?
It was good. She wasn't different than a lot of my other pediatric practice. She had asthma, she had some allergy issues, but that's pretty common in pediatrics.
Now, as a pediatrician, are you required by the state of Florida that if you see any signs of, confirmed signs of child abuse, that you have to report?
Absolutely.
Overruled. You can answer that question.
Sorry?
You can answer the question.
Yes, sir. I'm compelled to report it.
Tell the jury about Beata Kowalski from the times that you saw her and know her. What was she like in your professional view as a mother?
As a mother, she was very attentive, and I feel very loving towards her family and her children, very concerned about them always when I saw her.
Did you ever see at any time any indications whatsoever that Beata Kowalski contained any signs, warning signs, troublesome indications that would indicate that she might be in any way abusive to either of her children?
No.
So then, as the care progressed, then did there come a time when Maya started to have unusual pain symptoms?
That was after her July admission, when everything started.
Okay. And so let's look at, if we can, 1066-003. And we can pull it up here for you, Doctor, I think. And the date of this, for the record, is a visit of September 2nd, 2015.
Yes, sir.
And we've got this before you here. So what was going on with Maya at this time, just generally?
According to my note, that this was a follow-up of a series of ER visits and hospital visits, and she had had asthma exacerbations and had been requiring steroids, and had actually been admitted to All Children's on July 7, 2015 with an asthma exacerbation.
Does it say there how long she was? And I'm not sure it does. I'm not suggesting that it does, but.
She was discharged on the 11th, it says.
All right. So 4 days there at Johns Hopkins?
Mm-hmm.
All right. And so it says here she's had tremendous difficulties with pain control requiring high levels of analgesia. And did you see her then at this time and physically examine her on September 2nd, 2015?
Yes, I did examine her.
And what did the examination reveal, if anything?
Can you pop up to the next page, please?
Yes, that would help.
All right, that basically I did not have any focal findings on that particular time.
All right. Now, it says there, steroid-induced myopathy with severe intractable pain. Now, at this point, had anyone ID'd, if you will, CRPS?
No, sir.
Best of your knowledge. And had you seen Maya enough times at this point to be able to diagnose that?
No, sir.
And then it says here at the bottom, number 8, behavioral disturbance with possible conversion disorder. Can you tell the jury whether during the time that you saw Maya, either here or on down the road, whether she ever actually exhibited this, or whether this was a diagnosis or possible diagnosis taken from somewhere else that you noted?
It was just, I didn't see it, but it was from findings in the records from the period, you know, July till I saw her and follow up there.
So this came from Johns Hopkins, most probably?
Yes, sir.
But during the time that you actually saw her, did you, and you saw her in pain, can you tell the jury whether you ever saw any indications that Maya was making this up, or if either making it up out of whole cloth that she wasn't really in pain, or that she believed she was in pain, but she wasn't really in pain? Do you see any of it?
Okay, so standing leading.
Ah, yes. What, if any, signs did you see during the time you treated her of any conversion disorder?
I did not have findings over time consistent with conversion disorder.
And did you have any findings over time of factitious disorder?
No, sir.
And did you have any findings over time of Beata Kowalski being a perpetrator of Munchausen by proxy or any other derivative of child abuse?
No, sir.
Overruled. You can answer that.
And your answer was?
I did not see any signs of that.
Okay. So then, if we go to the next, and for the record, it's 1066-0005, and this is your visit of October 15th, 2015. And by this time, what's happening under history?
Okay, so in this time, she had been seen by Dr. Kirkpatrick of pain management, who had diagnosed her with the complex regional pain syndrome.
Did you know of Dr. Kirkpatrick?
I did not before that.
And did you come to find out what he did?
Yes, sir.
And what were his specializations?
Well, he's anesthesia / pain management, board certified in that with a specialty in the CRPS.
And did you come to find out he was the person who started the RSD Foundation?
I was not aware of that, sir.
What is the, is RSD another name for CRPS or an older name?
Yeah, older name is reflex sympathetic dystrophy.
All right, and so here, is there a particular treatment that she had started with? In the middle of history there, I think. She started on heated...
Okay, under her current medications, is there not a way for me to scroll this up?
no, I'm just looking under history of present illnesses. It says that she was started on...
Okay, start improved. Okay, so it says that she had received some ketamine treatments and that she had improved following the infusion series. She was taking oxycodone, which is a opioid pain medication, and Valium, which is a benzodiazepine, which is a muscle relaxant tranquilizer.
Now, were those medications prescribed to her before she came to you? The oxycodone and the...
Not to my knowledge.
So, and then she says she has recently been listed with glasses as she has been continuing having...
Diplopia, which is double vision.
And visual disturbances. Now, prior to this, was there any sign that Maya had these conditions, or was this the first onset?
This is the first that I was aware of it.
And in your review, did it come to your attention that this is, in fact, one of the symptoms of CRPS?
In my subsequent reading, I was aware that it falls within the spectrum of CRPS, yes, sir.
All right, and so then again, this is a carry forward on the next page, which is 0006. And again, it's carrying forward the same history of mood and behavior disturbance. But from this visit, again, did you see any signs whatsoever that Maya was actually exhibiting these, as opposed to moving forward a previously made diagnosis?
No, sir, I did not see any signs, and I need to make people aware that when I do these impressions at the bottom, and a lot of that is for my purpose of keeping in the back of my mind as things roll forward, what they've been through and what might enter into their care in the future. So I will tend to try and list significant problems, even if they aren't presently active at the time.
Now, if you are going to reach a, and I'm not sure if it's called a working diagnosis or a current diagnosis, can you explain to the jury what a differential diagnosis process is?
Okay, so Maya's complaints at the time were very unusual. In her extreme pain, it was difficult to manage. And so when you get that, you start running through your mind. Anytime you're talking to a patient, you're kind of listening to what symptoms they're having, what history they're giving, and you're kind of going through your mind, ruling things out or saying, no, this is still a possibility. And so when someone comes to you with terrible pain, history of weakness, you think about things like peripheral neuropathy, which is a nerve malfunction or damage. You think about rheumatoid conditions there are things called juvenile rheumatoid arthritis, which can give you pain and inflammation and disability. You think about Guillain-Barré, which is an ascending paralysis. So you're kind of, while you're talking to these people, you're kind of working through things, saying, okay, this needs to stay back there, and this, keep working it and seeing what happens. As I'm sure you'll get to at some point in the court proceedings, the complex regional pain syndrome is an unusual and uncommon medical condition that we don't understand especially well as far as what causes the symptomatology. We do suspect some autoimmune factors in it, but it is not something that I can do a blood test or I can do a CAT scan or some other test to say, okay, bam, she's got it. Okay, so experts in the past, when this was first described in the late 1800s, in pediatrics, 1970s, I think. But because it didn't have a hard and fast blood test you could do, or a CAT scan, or an X-ray, or something like that, a symposium of experts convened to try and standardize the description for complex regional pain syndrome so that they can make progress studying it and evaluating treatments for it, because you can't have everybody doing different things for something that's similar but doesn't fall into that category. So
what was the name of that?
The Budapest criteria was done, I believe, in 2010, and they came up with a series of requirements that this person needed to meet in order to be categorized to have complex regional pain syndrome. And then that's very important, because if you're studying treatments and you're studying outcomes and how they do over time, you have to have a similar population of people. And this is an unusual condition. There's not a lot of it that, there's not massive numbers of it running around. So if you want to study a rare condition, you have to make sure that your definitions are pretty strict, and you're studying a similar group. So that's what they attempted to do with the Budapest criteria.
Okay.
Sorry, that was a long-winded answer.
No, it's informative. I want to go back for a moment to the issue over who first prescribed the oxycodone. Let me show you and the jury what's been previously marked into evidence as 1008 is it 4? And if you can look down there, and I'm not sure if it's on this page.
Discharge, yeah, I see it. The patient was discharged on PO, Valium, oxycodone, Tylenol, ibuprofen.
And to your knowledge, was this her first opioid prescribed?
To my knowledge.
And this was by whom?
I'm assuming this is an all children's discharge.
Yes, it's an all children's. All right. So, now, let's turn then to a couple months later, November 5th, 2015, and that's it previously admitted into evidence 1066-0007. This is your visit, as I say, November 2015, so you're about, what, just less than a month later. So tell the jury what's going on here.
Okay, I'm got a blank screen right at the moment.
That makes it hard.
But I have paper back because I'm old school.
It's 100-4.
What was the date?
I'm sorry. It's 1066-0007. And I can put it up on here.
All right, there we go.
There we go. Okay. And is this your note?
This is my note.
What's happening now with Maya, and then we'll get into her family.
All right, so I go on to note that she was hospitalized at All Children's from October 20th to October 23rd with abdominal pain.
Was this then the second admission to the best of your knowledge?
To my knowledge, yes, sir.
Okay, go ahead.
They worked her up for abdominal pain. They said she was noted to have obstipation, which is a fancy name for severe constipation. On workup, they put a tube down her nose into her stomach to assist the treatment of that condition. And she was given something called Miralax, which is commonly used to resolve the condition.
So the jury's aware, this is before the Mexico visit, is it not?
To my knowledge, yes, sir.
All right. And so as of November 5th, 2015, this obstipation, that means that Maya was suffering from severe constipation right there?
That's what their assumption was, but as we can get into at some point, she has had ongoing abdominal complaints across time, of which there were some objective findings that I don't think that was the whole answer, is the long and the short.
Okay. All right. And so then she is seen by another pediatric GI. I'm trying to skip ahead here.
Okay.
And then it says there's something about the parents. Can you tell the jury what was going on with Mr. and Miss Kowalski?
So they were frustrated with the GI visit in that they didn't feel that her symptoms were being addressed. And I made the comment that Jack and Beata were taking turns attending Maya at night as her sleep was greatly disturbed and she would wake up with pain requiring the attendance of her parents. So both parents were having their sleep significantly shortened and attenuated by the ongoing symptoms.
Were the parents under stress at this point?
Absolutely.
And is that an unusual state for parents of a child with a painful condition?
Absolutely not. Any parent who's seen their child suffer and feels like they haven't gotten adequate resolution or control of that is going to be extremely stressed until that situation is met.
Now, underneath the current medications, can you tell the jury whether, and on the next page, plan, it also talks about, what I'm trying to inform the jury of is what meds were you and what meds did you receive back from, that had been previously described by All Children's or someone else?
Okay, so there's quite an extensive list of medications at the time I saw her on November 5th. Basically all those, she came to me with those from other physicians. The only change I made was to put her on a more powerful acid blocker to try and get her some improved control of her GI symptoms.
And again, at this point, any signs of conversion or factitious disorder or any other psychiatric, psychological problem?
Not by my account.
Let's then go to what's been previously marked into evidence as 1066-0009. For the record, Your Honor, this is a visit of December 17th, 2015, again about a month and a week after the last one. So, what's going on here now?
Okay, so now she has come back to me from her trip to Monterrey, Mexico, where she underwent the ketamine induced coma for 5 days. And mother had reported that she had significant improvement following that treatment.
And I take it that you knew she was going to do the Mexico trip before they went?
Yes, sir.
And from your research, what were your thoughts of Maya undergoing this? And first let me ask you, in your review, did it appear that Maya had already been treated with the typical, if you will, first stage treatment of CRPS by this point?
I'm not sure of the actual question, so why don't we start with
It may not have been a question. What I'm trying to get at is, what, if any, investigation did you do in looking at whether Maya's trip to Mexico was warranted from prior care?
So basically, Maya had been tried on the usual things that pain management does, and we do a significant amount of these conventional things in primary care, use of different non-narcotic pain medications, things called like tramadol, and I think the ketorolac, and I see a clonidine in there. At one point she was on things called gabapentin. So they had really run through the usual list of things that we try outpatient for pain control.
And had she been through the regimen of OT, PT?
Yes, she's been trying that all along.
And for the jury, what are those, OT, PT?
Oh, sorry, yes. Occupational therapy and physical therapy. They try and improve her conditioning and use of her extremities and try and prevent long-term damage or contractures and loss of use. One thing I should say is that when you have difficult to treat conditions that aren't responding to usual modalities, it's not unusual for parents to seek other options and other treatment, especially if they see their child is having ongoing pain that's not being adequately controlled by the medical establishment. So I'm not surprised. I have a lot of motivated parents that, you know, start doing research, start contacting institutions and things to see, okay, the conventional stuff isn't working, what else do we have? And so that by itself isn't unusual.
So, and what was Beata's profession?
She was a registered nurse, specifically trained in IV infusions.
From your interaction with her, did she appear to have a good, bad, working, or excellent, strike it, how would you describe her medical knowledge for an RN of her experience?
So Beata is a very intelligent, assertive female with an excellent knowledge base, and sometimes medical professionals push back against that. But she knew what she was talking about, and she was very smart.
And so there's been some testimony about risk factors in this type of treatment, the one in Mexico. What, if any, concerns did you have, and how did you resolve it? Within your mind as a attending pediatrician for the family.
Well, it's definitely an unusual line of treatment that certainly I hadn't had previous experience with. So, I know that the parents were looking to help their little girl, and that they had tried all the usual things, and so they were going after this. If I can expound on the moment, ketamine has been used. Ketamine is now used in a wide variety of.
Hold on,
Sir.
You kind of need to wait for a question.
Okay, sorry.
This treatment involved ketamine. Can you explain to the jury a little bit about how your knowledge of ketamine influenced any advice you gave to the family?
Yes, Your Honor, calls for a narrative answer.
Overruled on that one. You can answer.
Can you, I'm sorry, rephrase it one more time?
Sure. Can you tell the jury, insofar as the advice you were giving the parents about this, how your knowledge of ketamine and whether that influenced it?
I did not have adequate experience with the use of ketamine in that particular circumstance to give them a good background one way or another as far as whether it would be helpful, but I had heard of a wide variety of uses for ketamine in the past, IV ketamine.
And was there a physician involved who did have experience in these?
That definitely falls into the purview of pain management specialists, especially if they're trying to complete or treat something like complex regional pain syndrome.
And had she been to Dr. Kirkpatrick by that time?
Yes, sir.
And in your professional opinion, did Dr. Kirkpatrick have the necessary history, training, and specialization to advise the family in that?
Yes, sir.
Objection, Judge Locke, Foundation.
Overruled that objection.
So now, can you explain a little bit about ketamine and how it functions in this CRPS venue to the jury?
I am not an expert on the use of the
How about this?
pathophysiology.
How about, what is the history of ketamine as a treatment?
Ketamine is used.
Objection, Your Honor, it's a lack of foundation. No knowledge or expertise has been demonstrated.
Why don't you
I'll
show
let
more
her.
foundation?
Yes, sir. So through the course of your practice, have you had the opportunity to follow patients who have been through surgeries?
Yes, sir.
And have those surgeries involved sedation using ketamine?
Yes, sir.
And through the need to understand the patients, have you had the opportunity to perform research or otherwise inquire to ensure you had adequate knowledge of the function of this drug?
It came up during my training as far as pharmacologic teachings, but nothing extra on top of that.
While not an expert in it, are you familiar with the basics of ketamine insofar as its general uses in medicine?
Yes, sir.
Let me ask again. Can you give the jury a bit of an overview of the uses of ketamine in treatment of various diseases?
So obviously we're here talking about ketamine to be used in complex regional pain syndrome. It's also been used in induction. It's also been used, induction of anesthesia. It's also been used in refractory depression that hasn't responded well to other of our conventional medications. And that one, actually, you can get IV infusions of ketamine in Sarasota now for refractory depression by,
All right. So,
trained specialists. And so it's not uncommon.
is it FDA approved for that use now?
I believe it is for the depression.
And so the use of ketamine in this instance to treat CRPS, what is the term off-brand or off-label?
Label.
What can you explain to the jury what that means?
So frequently in medicine, a drug is originally approved for a very specific indication. Say, for instance, amitriptyline was originally approved for depression. We don't use it that much for depression anymore because it's not great for that. We have better drugs, but we use it off-label for sleep disturbance. We use it for recurrent headaches. We use it in pain management. So a lot of times a drug was approved for a specific indication by the government, the FDA, and later on through research and trial and error and things, it gets used for other conditions that originally it wasn't studied for. Most companies don't go back to the FDA and get those specific approvals because that's an expensive process and very time-consuming and expensive.
All right, going back to the visit then, 1066-009, you noted that, quote, skin lesions she was suffering from have resolved. Tell us about Maya's skin lesions and the relationship to CRPS.
Well, one of the things that is described in CRPS is these nonspecific lesions that are on their extremities that sometimes can correlate with the activity of the disease, but to my knowledge, to the present understanding, these lesions aren't definitive proof, so I can't biopsy these lesions and say, okay, that's a CRPS lesion. They've been noted by other clinicians to occur during the course of the disease, but at this point of our understanding, they do not help you nail the diagnosis, if you will.
Were her lesions improving?
Well, they had, I didn't comment on my note there that there was anything unusual for me to see, so by definition, they must have improved.
But she had had skin lesions apparently before going to Mexico?
That's my understanding.
And this is after Mexico or before?
This one's after.
Okay. All right. And after Mexico, can you tell the jury whether she had improvement in her asthma?
Yes, she did have improvement in her asthma, and that is one of the things that her pulmonologist had commented on, that ketamine is sometimes useful for relieving bronchospasm and helping control asthma, so it has had a little side benefit there.
As to the latest research on the relationship of different skin lesions to CRPS, would you defer to the CRPS experts?
Absolutely.
And so it says, still in a wheelchair, but can be touched and examined more readily than before. Can you explain to the jury what allodynia is insofar as Maya's CRPS and why this is important? Okay,
so that's a very important thing to appreciate, because until you've seen it on a patient, it's very striking. So allodynia is another fancy name for saying that a slight or a light touch, a normal touch, if you will, causes severe pain in an individual. So a light brush can cause excruciating pain. And it is one of the factors that's in the definition or criteria for CRPS by the Budapest criteria. It can occur in other conditions. I have another patient who had a cervical spine injury that had severe allodynia. And if you haven't seen it before, and I think that's part of the problem where some of these physicians, when they are assessing Maya, you think, well, this person's carrying on, they're being histrionic, they're exaggerating, okay? Because it doesn't initially make sense to you as, oh, all I did was barely touch her, and she, jumped back and carried on. And for those people, it's a real it's a real thing. It's a real, it's not a fake. At some point, they'll talk to you about the McGill pain score developed by a famous Canadian medical university, assessing different levels of pain attributed to different conditions. And it's very near the top. It's a difficult
response for the question.
What is the McGill pain scale?
It is a scale developed at McGill University to show levels of pain attributed to various conditions.
Do we have that readily, or can we find that? If we can't, we can wait and move on. But and then if you'll let us know an exhibit number before we display it.
It's not.
It's not an exhibit yet? We'll hold off. Okay. So then you saw her again on February 22nd, 2016. I think we'll skip ahead of the interest of time on that one. And then go to what's been previously marked in evidence 1066-0013, which is your visit of April 1st, 2016. All right. So tell the jury what's happening here under a history of present illness.
Okay, so she had been getting, this is April 2016, she had been getting ketamine infusions 3 to 5 times a week for the month of March and was having physical therapy. At that time, she had had a port placed in her left lateral chest.
By whom?
All children's, I believe.
By
Let me explain
Johns
to the
Hopkins, all
jury what a
children's?
port is and what they use it for real quick. It's just a device planted underneath the skin. We frequently use, say, in chemotherapy for cancer patients or for children who have blood conditions that require frequent laboratory studies or treatments. So it's a little device that's inserted underneath the skin. It has a tube that goes into their circulation. It makes access easier for their treatments.
And this was placed by Johns Hopkins All Children's Hospital?
Yes, sir.
All right. And so you say here to schedule to get some IVIG treatment. What is that?
Okay, intravenous immune globulin. So basically, that's a product that's used in medicine, purified form of a protein that's important in the immune system. IVIG has a wide variety of uses, even in neurologic conditions. We use it to treat Guillain-Barré, which is the ascending paralysis condition. And in children who have immune deficiency and are susceptible to infections, we use it in that circumstance. So it has and actually there was a paper that they used IVIG specifically with.
Objection, Your Honor, the medical literature being used to bolster.
He hasn't identified it and he hasn't stated it.
Overruled that objection. You can continue.
Go ahead.
There is a paper that wrote about the use of IVIG in CRPS.
All right, and then it says here in the middle of present illness, her appetite is variable, but she looks better. Can you tell the jury from what you recall, how did Maya look better? What was significant to you, if anything?
Just that she had looked physically feeling better than on her previous visits with me.
Mm-hmm. More talkative, more movement, a little better? Mm-hmm. Okay. And then under impressions, your number one impression was? At the bottom?
The CRPS. Mm-hmm.
Mm-hmm. Okay. Now let's move then to what's been previously marked in evidence as 1066-0015. And for the record, this is a visit with you of August 11th, 2016. So now we're 4 months later. And how's Maya doing now? She's some, 9 months post-Mexico.
Okay, so she's doing her physical therapy in the pool 3 days a week. Make the remark that she's made significant progress. At the time, she was getting the IVIG treatments and scheduled to start ketamine treatments again.
And it also says she'd finished 40 hyperbaric treatments in mid-July. Do you know whether the Kowalskis were looking for other treatments to supplant the ketamine at this time?
They were investigating various options to try and bolster her and get her better, and that was one of them.
And ketamine treatments were fairly expensive, or do you know?
They're expensive.
So was this an attempt to find a more,
Objection, Your Honor. It calls for speculation of the state of mind of someone.
well, I haven't finished the question.
Okay, well, let's let him finish the question, but let's make sure it's not speculation.
I'll rearrange. What, if anything, was their goal in using the hyperbaric and the IVIG insofar as the continued use of the ketamine?
What did I think about the treatments of the
I'll
IVIG?
withdraw. Don't worry about it.
Okay.
All right. So at this point, what's her weight there? Under physical exam?
29.4 kilos.
Okay. So what does it say there in this first paragraph under history? How is her appetite? It's a
We're
less.
talking about the August 6, 2016 visit?
Yes, sir. Under the history of present illness, that first paragraph, last sentence.
Appetite was good, and she had a good weight gain.
All right. So overall, now 9 months after the Mexico treatment, what was your impression of how Maya was doing insofar as her CRPS and overall health?
It was progress.
Let's then go to February 22nd, 2016. Let me see, am I out of the, no, sorry. I think we've already been through that. Yeah, we've already done that one. One moment. All right, so I'd like to talk a little bit about Maya's weight before and after she went into Johns Hopkins All Children's Hospital on that October 7th through October 7th, 2016 through January 14th, 2017 visit. We're here about.
Hold on, one second, Dr. Wassenaar. Dr. Wassenaar just pulled out some files.
Yes.
Okay.
I told counsel he was bringing his files, and we previously marked into evidence the one that we're going to use, which I'll reference now, Your Honor.
That's fine.
There's 2792.0-001, and then Dr. Wassenaar, if you have other records that confirm this chart, let us know as we ask questions. But if we could bring up 2792-001 for the jury. Okay.
Can I explain what this is?
Yeah, can you explain what this is?
Okay. So in pediatrics, we use growth charts for height and weight, pretty standard from the time they're newborn up until 18. It's basically a graph constructed from measurements over thousands of children. It's standardized. The bottom of the graph is the 5th percentile, the top on this particular one, 97th percentile. Anything between the top and the bottom of the graph is considered normal. The dark line in the middle is considered the median, the 50th percentile. In pediatrics, we use it to assess for deviations in the patient's condition. So, for instance, if we get an infant that's failing to thrive, that they're following a particular line on the growth chart, and suddenly they're falling off that line, they're falling below, or conversely, if it's going up, then that's your cue to ask more questions, do more investigations, what's going on, that they're falling off their growth curve.
Now, did I ask you to go back and look at weights of Maya immediately before she went in to Johns Hopkins All Children's Hospital on October 7th, 2016, and your next visit immediately after her January 14th, 2017 visit.
Yes, sir.
Can you tell the jury what your findings were?
Basically, that the weight in August of 2016 was 64.8 pounds, and when she came out, she was 64.6 pounds, so no real change.
But she'd actually gone down 0.2 pounds?
Yes, sir.
So there's been a representation here that Maya gained weight during her visit. From your records, is that confirmed or rejected?
By my records, by my scales that we normally weigh her on, she was essentially the same or slightly less.
No significant gain at Johns Hopkins from your weights?
Objection, Your Honor, leading.
What, if any, weight gain at Johns Hopkins was reflected, if any?
Nothing was reflected as far as gaining weight.
Okay. Tell us about Kyle now. There was an allegation raised about Kyle Kowalski and failing to thrive or malnourished. Can you tell the jury about Kyle's?
I object to the predicate, Judge. There's an allegation
It's from
being
the-
quoted that I'm not aware of.
Sustained, let's just ask questions without the commentary.
Tell us about Kyle's weight.
Kyle's been a pretty healthy guy, and I don't get to see him very much. And he looks, like a lot of my other teenage males, long and slender, and can probably eat you out of house and home. So I don't have any concerns regarding Kyle.
Got it. Now, did there come a time that, hang on one moment, let me see. I wanted to continue on then onto 1066-10017. And this is a visit, January 18th, 2017, noting for the record that Maya had left Johns Hopkins All Children's Hospital on the 14th. Now, if you would, just review that again. It's 1066-0017.
This is the one in 2017 visit?
Yes, sir.
So basically, this is the first time I've seen Maya since coming out of All Children's, and it was, as I made the comment, a terrible ordeal. I made the comment that Child Protective Services stepped in and removed custody of Maya from the parents, and that they were accused of Munchausen by proxy, and labeling the child as having a fictitious disorder or a conversion disorder.
Again, had you ever seen any signs of that as the family pediatrician?
No.
How was Maya doing physically after the ministrations of Johns Hopkins All Children's Hospital?
Not great, but she was grateful to be out of the hospital.
Okay. And it says that in the middle there, Maya continues to have great difficulties and is in worse physical shape than what she went in.
Yes, sir.
You see that? Was that your observation at the
That's my
time?
observation.
And then it says, prior to her being admitted, she was able to push herself around in the house with a wheelchair and do transfers back and forth from the chair to the wheelchair. And was she able to do that now that she'd been in there for 3.5 months?
She was much more sensitive to the pain.
Did it appear that the CRPS had improved or gotten worse from your
Gotten
perspective?
worse, in my opinion.
Then at the bottom, the third line or fourth line up from the first paragraph, history of illness, Did you note some scattered lesions on her arm?
Mm-hmm. Yes, sir.
Can you tell the jury whether these appear to be substantially the same as the lesions that you had noted prior to her going in to Johns Hopkins?
Prior to
Did they look the same, generally the same as the ones you'd seen?
Generally the same, yes, sir.
All right. And so she is going then to see a specialist in Rhode Island,
Yes, sir.
and by this point, her mother's passed.
Yes, sir. She passed on January 7th.
All right. Now, I want to ask you, if we can, about the time period when the Kowalskis went in on October 7th. Over this period, those first few days at Johns Hopkins, what, if any, contact did you have with anyone there?
I received a call from a resident physician from All Children's just asking some basic questions about her condition.
And how long was the phone call, would you say?
A few minutes.
And during that phone call, did he explain to you that they were questioning her CRPS diagnosis?
No, that was not made clear in my conversation with them.
Did they ask you anything about your knowledge or your basis of knowledge as to whether there was any history indicative of Munchausen by proxy?
No, sir.
Did they ask you for any information about your knowledge of whether you saw any signs in Maya of conversion disorder or factitious disorder?
No, sir.
Did it surprise you when you learned what was actually going on?
Yes, very much.
Yes, Your Honor, surprise is irrelevant.
I'm sorry, what's the legal
Irrelevant.
basis?
Irrelevant.
Overruled.
And can you tell the jury what's wrong with this picture? In other words, if it is, what are your concerns with the level of investigation with you under these circumstances?
If you're considering a patient having conversion disorder or Munchausen by proxy, in which someone is inflicting harm on a patient, it can be a very difficult thing to establish, and so you need to talk to multiple physicians and multiple individuals to get their perspective on, you basically get all the information, basically saying, does this have basis, does this have merit? And it's very difficult. The consequences are high if you get it wrong, if you accuse somebody of it, and it's not the case, it's a terrible thing. If you have a case and they miss it, and the child goes on to be, subject to this, it's also a terrible thing. So it's very important that you utilize all the information at hand, and you certainly, in the articles I've read, talking to the primary care physician is one of the big components of that.
And are you, through those conversations,
Hold on one second, Mr. Anderson.
May we approach?
You may. Members of the jury, I'm going to direct that you disregard that last answer, and I'm going to sustain the objection. I'm going to remind you that the court has already determined that there was a good faith basis for the call to the Central Abuse Hotline. Now, Mr. Anderson will be allowed to ask follow-up questions relative to the standard of care, though. Mr. Anderson.
Leaving aside anything about the court order here, the initial two calls, but just dealing with the standard of care here for pediatricians in this situation. What is the standard of care in terms of contacting the prior treating physicians, including the attending pediatrician?
It would be my hope that that would be mandatory.
And what are the risks if the doctor, the hospital in this instance, fails to contact the prior treating physicians?
Then you're at risk of making a grave mistake, and child protection team is a difficult, it's a difficult.
We'll stay away from that.
Okay.
So there's no question pending, and whoever's cell phone's going off in the audience, let's turn it off, please.
I'm sorry, rephrase the question.
He's going to ask you a different question.
Yes. Okay. Now, prior to this, did I ask you to review the records of Maya's liver function? And those are related, among others, in 1066-38 through, and we don't have to pull these up, it's just for the record.
Is that the end of the question?
Yeah, not yet. I'm trying to make sure I get the record straight here. Among others, 1066, 38, and 39. But did I ask you to review Maya's chart insofar as her liver functions around the time that she returned from Mexico and from there on during the ketamine treatment?
Yes, sir.
And
Do we have a clarification of where these records he's been asked to review come from?
Please do that.
yes, have you, all right. Through the course of your care and treatment of Maya, did many of the providers provide you with their notes and test results?
I saw the lab results performed by Dr. Kirkpatrick and Dr. Hanna on occasion and saw their liver function test, yes, sir.
And your chart, does it not, reflects notations from, among others, Johns Hopkins All Children's Hospital and from Tampa General Hospital, does it not? And if you
My
have,
recollection, sir.
okay, and from Sarasota General.
Yes, sir, but I don't have those open in front of me right now.
Okay. Well, for example, as to, I think this is Sarasota. Yes, Memorial at 1066-0038 to 1066-0039. And on to 1066-0040, 1066-0041, 1066-0042, 43.
Is there a question, Mr. Anderson?
Yes, I wanted to make sure I had the record clear of what was in evidence, Your Honor. Based on your review of the records provided to you, the blood work done on Maya Kowalski, first, did she have any issues insofar as cholesterol or other typical issues?
I had seen a blood result. I don't have it in front of me, and I can't tell you when it was, that she had high cholesterol at one point.
Okay.
I'm looking at this lab report from 6/18/19, it shows essentially normal liver function tests.
Okay. And working backwards then, in your review, did you see any indications that the ketamine treatment was causing any damage or problems to her liver?
No, sir, I did not see that.
If Maya had had any difficulties with cognitive function as a result of her ketamine treatments, did you see, and I'm just asking this, I don't know, and did you see her enough times to be able to tell if she was displaying some?
I never saw any evidence of cognitive dysfunction with Maya.
There was a medical referral form, and I think this one, make sure I've got the date here. I believe it's, is it 1066-0097, the one immediately before or during the period of time of relapse. Let's pull it up and see if we got the right one here. This is in evidence and part of his record, Your Honor. All right. Now, did there come a time on a medical referral form where you had written to the school board various reasons why Maya should stay in her homeschooling program rather than going back into school? This is before the Johns Hopkins admission.
Okay. Yes, and I've done this in a number of circumstances with other children with chronic medical conditions. It was my opinion that in this circumstance, with her complex medical history and the things she'd been going through, that she was best served by continuing her hospital homebound status, meaning that teachers would come and work with her at home, and that way she could go get her treatment, she could get physical therapy, she could get the things that she needed to do. And it was my opinion that she would be best served by doing this.
So, for instance, where at least one of them reflects that some of the medications that Maya takes may cause some lack of function. Was that because you're actually observing it, or because the school board needed some reasons why?
School board needed a reason. It wasn't, I'm trying to work within the parameters they give me. The medications that she was on, in theory, could have caused difficulties, but I did not witness those.
Was this a chance? Was this just the family asked you to help them, and you were trying to help them with?
Yes.
All right. Now, I noticed also in your records you received several notes from Johns Hopkins, both before and after the Mexico trip. And I'd like to take you through one before and one after. There is one which has been previously marked into evidence as 1066-0103. And this is from Dr. Anthony Kreisman, Tony Kreisman. It's dated August 17th. Maybe that's the wrong one. I'll make sure I've got the right one. Okay, let's show instead, wrong year, sorry about that. Exhibit 1066-106 and 1066-0107. So it's 0106, 0107. First, on dash 01006, at this time, how many medications did Dr. Kreisman at Johns Hopkins note that Maya had?
There are 17 on her medication list.
The record speaks for itself. He's asking for opinion regarding another witness's record.
Let's just go with legal basis. I'm gonna sustain the objection.
Predicate.
Yeah, still sustain.
All right, and so, does it reflect there that Dr. Kreisman was noting that Maya was receiving ketamine infusions
Same
there
objection.
at the
Judge.
top?
That's,
This is part of his file. It's a
I'm
note.
gonna overrule this one, but we're not gonna read the entire file here.
No,
Okay.
I don't plan to. All right. And does it indicate also that she had begun hyperbaric oxygen therapy?
yes, sir.
If you look then on the next page, can you tell us the note from Dr. Kreisman back to you under the physical examinations, what he was reporting to you in terms of, let's see.
Same objection, Judge. Apparently we need to approach.
Do we need to approach Mr. Anderson, because I'm gonna sustain the objection?
Judge, I'm just asking him whether he was advised by the hospital on a particular point.
Sustain the objection. Let's move on.
So how is Maya doing of late? Strike that. Did there come a time after she left Johns Hopkins that she had a relapse of her CRPS?
She had a period where her weight went down dramatically, and she again developed pain in her extremities.
And was it necessary then to hospitalize her?
It became necessary to hospitalize Maya when all our measures trying to get her weight up and to treat her effectively as an outpatient failed. And we were very sensitive to the fact that the last thing that Maya and her family wanted to do was go back in the hospital, and we tried as long as we could until it was clear we were at a dangerous point that we needed to hospitalize.
Did Maya want to go in or not go in?
She didn't want to go in.
And did this involve a feeding tube?
Yes, sir, it did.
And Maya was complaining of pain in her midsection and extremities at this time?
Yes, sir.
And do you know, if you do, whether this was caused by something physical or emotional? And I'm not asking for the actual event, but if you know which it was.
I think it was caused by both. I think she was under extreme stress at the time, and I think things went south on us in a hurry.
Now, insofar as how Maya is strike that. Let me show you trial exhibit for marker identification 2375 and ask you whether this appears as part of your medical records. I'll have it brought up there. I have a hard copy if you need.
Yes, this was a letter sent to me by Beata after the protective order was put in place.
All right. And then why did you place this in your file?
Just because I thought it underscored that, she wasn't being abused, that people weren't doing things to her, that she, put her in pain and was, it underscored to me how much she loved her parents and how much she wanted to be reunited with them.
Did it advise you of her a medical and emotional condition?
Yes.
And this has been previously admitted, Judge?
Yes.
Permission to publish the original to the jury but I need to show the witness first to elaborate on what's in the back. May I approach?
Why don't you get it from the clerk?
It's here.
The clerk has the original.
Now, on the back side of this, are there any imprints there that you noted?
There was some areas of increased coloration that were, I assume, corresponding to the kisses she was sending to her family.
Permission to publish the physical?
You may. Again, members of the jury, you're going to have all the exhibits in the back room with you when you deliberate. So this will not be the only time you get to see this or any of the other exhibits.
I know what I'm going to ask you. May I proceed while they're observing that, Your Honor?
If we're having the jury look at something, we should wait. Doctor, you can't be looking at your phone right now.
Sorry.
Mr. Anderson, just to let you know, we've been going for about an hour and 20 minutes, so at some point in the next 15 or 20 minutes, we need to take a break.
I will be done before 10:30, Your Honor.
Okay.
Two more areas of questions, Doctor. You previously testified concerning the standard of care in these circumstances. The standard of care in this area, do you have an opinion based upon your background, training, and experience and knowledge of the standard in this area, as you previously testified, as to whether failure to advise oneself, a physician's failure to advise himself or herself of the history of the family with, among others, the treating pediatrician, is a breach of that standard of care?
I believe so.
Overruled.
I believe it is.
I want to take you back to one other point. On the 5th of August 2015, and I'm not sure where whether we've got that one to bring up real quick, but there was a prescription for Xanax and Celexa to Beata Kowalski. I don't know if you recall prescribing those to her.
Yes, sir.
What was the purpose?
Maintenance medications. I'd say half to a third of my patients is probably on SSRIs or benzodiazepines these days, and so it's a stressful world out there, and we use the tools we have to try and get them through these stressors.
And were the Kowalskis going through at this point in 2015, before anyone diagnosed what was wrong with their child, a stressful period?
Yes, sir.
And did you then diagnose her as having any type of psychological disorder, or was this simply a episodic event?
No, I did not diagnose her as having a psychological disorder. It was simply given to her to try and help her cope with the stress.
Thank you, doctor. Their witness.
Is your cross gonna be more than about 10 minutes? Just trying to figure out when we're gonna take a break, and it sounds like we're gonna take a nap. I see that one of the jurors had is that a question? Is it a question for the doctor? We need to wait until all the questions are asked, so why don't you move on to that? Members of the jury, we're going to take a break. Let's try to keep it to 15 minutes. Do not discuss this case amongst yourselves. Do not do any investigation and receive no information about this case. And we'll call you back in about 15 minutes.
All rise, jurors exit.
Okay. Please be seated, everyone. The jury is out of our presence. Dr. Wassenauer, while we're on break, you cannot discuss this case with either side. If you need to return your emails and calls, that's fine, so long as it has nothing to do with this case, okay? Any issues we need to address before we take our break? Okay, we'll be in recess for 15 minutes. I appreciate it. And make this call.